12 early signs your heart is in danger. Did you know that heart disease remains the leading cause of death globally, claiming an estimated 17.9 million lives each year? That's about 1/3 of all global deaths, according to the World Health Organization. In the United States alone, someone dies from cardiovascular disease every 33 seconds. Despite advances in medicine and technology, heart disease continues to be a silent predator, often showing no clear symptoms until it's dangerously advanced. What's even more alarming is that many people are walking around with a weak or diseased heart and don't even know it. Early signs and subtle symptoms are frequently brushed off as fatigue, stress, or just getting older. But your body is always speaking. It's trying to tell you something, sometimes through shortness of breath, swollen ankles, or an unusually fast heartbeat. These small signals can be critical warnings of an underlying heart problem. In this video, we'll uncover the early warning signs that suggest your heart may be under stress, weak, or even disease. By paying attention to these subtle indicators, you can take proactive steps to protect your heart before it's too late. Whether you're in your 30s, 40s, or beyond, understanding what your body is trying to tell you could save your life. Let's get started. 1. Fatigue that doesn't go away. It's normal to feel tired occasionally, especially after a long day or poor sleep. But when fatigue becomes persistent and doesn't improve with rest, it could be a red flag. Chronic fatigue is often one of the earliest signs of heart failure or a weakening heart. This happens because your heart isn't pumping enough blood to meet your body's needs. As a result, your muscles and tissues aren't receiving enough oxygen and nutrients, leading to low energy levels and constant exhaustion. Women, in particular, are more likely to report fatigue as a primary symptom of heart disease. Unfortunately, because it's such a common complaint, it often goes unrecognized. If you find yourself feeling drained after light activities like walking or doing household chores, or you wake up feeling as tired as when you went to bed, it's time to talk to your doctor. 2. Shortness of breath. Struggling to catch your breath after climbing stairs or doing light exercise may be more than just being out of shape. When your heart is weakened, it can't pump blood efficiently, causing fluid to back up in the lungs. This fluid buildup can make breathing difficult, especially when lying flat, a condition known as orthopnea. Shortness of breath that worsens at night or with exertion is a classic sign of heart failure. Many people confuse this with asthma, anxiety, or other respiratory conditions, but it's important to rule out cardiac causes, especially if it's a new or worsening symptom. 3. Chest discomfort or pain. While chest pain is a well-known sign of heart problems, it's important to understand that it doesn't always feel like a sharp stabbing sensation. Sometimes, it presents as a dull pressure, burning, tightness, heaviness, or even a squeezing feeling in your chest. This discomfort may come and go or be triggered by physical activity or stress. In many cases, it may not even occur in the chest. Instead, you may feel it in your arm, neck, jaw, or back. Known as angina, this kind of pain signals that your heart isn't getting enough oxygen-rich blood, a hallmark of coronary artery disease. It's especially concerning if chest discomfort occurs during activity and goes away with rest, as this pattern typically signals a lack of adequate blood flow to the heart muscle. 4. Irregular heartbeat or palpitations. Have you ever felt like your heart was skipping a beat, fluttering, or pounding in your chest? Occasional palpitations can be caused by stress, caffeine, or lack of sleep. But frequent or persistent irregular heartbeats known medically as arrhythmias can indicate a serious heart condition. When the heart's electrical signals are out of rhythm, the heart may not pump blood effectively. This can lead to fatigue, dizziness, and even fainting. Conditions like atrial fibrillation increase the risk of stroke and heart failure and often begin with subtle signs like a racing heart during rest or sleep. Don't ignore persistent heart palpitations. Even if they seem harmless, they could be an early signal of a serious electrical or structural heart problem. 5. Swelling in legs, ankles, or feet. If you've noticed your shoes getting tighter or your ankles looking puffier than usual, it could be more than a salt-heavy diet. Swelling in the lower extremities, known as peripheral edema, can be a sign that your heart is not functioning properly. When the heart is weak, it struggles to circulate blood effectively. This causes fluid to build up in your legs, ankles, and feet due to gravity. This type of swelling is often more noticeable at the end of the day and may leave a dent in your skin if you press on it. Chronic leg swelling, particularly when accompanied by shortness of breath or fatigue, should never be ignored. It often points to heart failure or venous insufficiency. 6. Persistent cough or wheezing. A nagging, dry cough that doesn't go away could be related to your heart, not your lungs. When the heart's pumping power diminishes, fluid can leak into the lungs, causing congestion. This leads to a condition known as cardiac asthma. This cough is usually worse at night and may produce frothy or blood-tinged mucus. Some people also experience wheezing that resembles asthma but doesn't improve with standard asthma medications. If you've developed a chronic cough with no clear cause, especially if you're also experiencing shortness of breath, swelling, or fatigue, it's wise to get your heart checked. 7. Dizziness, lightheadedness, or fainting. Feeling dizzy or faint can be unsettling, and it might be your heart's way of saying it's not getting enough blood to the brain. These symptoms can occur when blood pressure drops suddenly or when the heart isn't pumping efficiently, leading to poor cerebral circulation. This could be due to arrhythmias, valve problems, or even heart failure. People with heart conditions often experience dizziness when standing up too quickly, during exertion, or for seemingly no reason at all. Repeated episodes of lightheadedness or fainting, also called syncope, require immediate evaluation, as they could signal life-threatening cardiac problems. 8. Nausea or indigestion-like sensation. Believe it or not, heart attacks don't always come with chest pain. Some people, especially women, experience nausea, indigestion, or even vomiting as warning signs of a cardiac event. These symptoms can easily be mistaken for gastrointestinal issues, leading to delayed treatment. This is because when the heart lacks oxygen, it can trigger signals in the vagus nerve, which also affects digestion. This overlap causes sensations like queasiness, fullness, or pain in the upper abdomen. Never assume that persistent nausea, especially if paired with lightheadedness or sweating, is just something you ate. If it feels unusual or comes with other symptoms, consider it a potential heart. 9. Cold hands and feet. Poor circulation due to a weakened heart can make your extremities feel consistently cold. Your body prioritizes sending blood to vital organs like the brain and heart, pulling circulation away from less critical areas such as your hands and feet. This symptom may also appear as bluish or pale skin color in the fingers or toes. Cold extremities, particularly when associated with fatigue or shortness of breath, may suggest poor cardiac output or peripheral artery disease, a condition linked to heart disease. 10. Erectile dysfunction in men. While it may seem unrelated, trouble achieving or maintaining an erection can actually be one of the earliest signs of cardiovascular disease in men. That's because erections require healthy blood flow, and blocked or narrowed arteries reduce this circulation. Erectile dysfunction can precede the development of heart problems by several years, making it an early indicator of vascular disease. In fact, many cardiologists now consider erectile dysfunction as a warning sign that the arteries may be compromised. If erectile dysfunction is an ongoing issue, don't just seek a quick fix, investigate the possibility of underlying heart disease. 11. Sleep problems, especially sleep apnea. Sleep disorders like obstructive sleep apnea are closely linked to heart disease. Obstructive sleep apnea causes you to stop breathing multiple times during the night, reducing oxygen levels and placing a significant strain on the heart. This repeated stress can lead to high blood pressure, arrhythmias, stroke, and heart failure. If you snore loudly, feel excessively tired during the day, or have been told you stop breathing at night, it's essential to get evaluated. Proper treatment of sleep apnea, such as using a CPAP machine, can significantly reduce your heart disease risk and improve your quality of life. 12. Sudden weight gain. Unexplained weight gain, particularly over a few days, could be due to fluid retention, a hallmark of heart failure. This weight isn't fat-related. It's caused by the heart's inability to pump effectively, leading to fluid buildup in the body. You might notice a tight feeling in your abdomen, swelling in your legs, or difficulty fitting into your clothes. Rapid weight gain should never be ignored, as it often signals worsening heart function. Recognizing the early signs and symptoms of heart disease is crucial for timely intervention and management. Symptoms such as chest discomfort, shortness of breath, fatigue, and swelling should not be ignored. It's important to consult healthcare professionals for proper evaluation and to adopt lifestyle changes that promote heart health. Regular checkups, a balanced diet, physical activity, and stress management are key components in preventing and managing heart disease. If you learned something today, like, share, and subscribe for more health content like this. And if you or someone you know has these symptoms, don't wait. See a doctor now.